Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Monigle, welcome and thank you for joining us. There's no doubt that the COVID-19 pandemic has transformed the world, nowhere more so than in healthcare. Nationwide, healthcare executives have driven innovation that is humanizing healthcare on a structural, organizational, and experiential level. In today's webinar, 4 pandemic-driven imperatives to create a more human healthcare experience, you'll hear from leaders who are humanizing their organizations from the inside out. We'll learn how they are transforming organization and structure as well as mindset and culture. One note before we begin. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, I'll turn the program over to Justin Wartell, Managing Principal at Monigle, who will be leading today's discussion. Justin?
Thank you, Daniel. We appreciate the opportunity to join you today, and thank you also to the Forum for Healthcare Strategists for the opportunity to share. Most important as well, thank you to the speakers here today. You're going to hear mostly from 3 of the folks listed here, much more their voices than mine, especially in the spirit of providing insight and action associated with some of the things happening across the industry. Cindy, Jim, Chris, thank you so much for being a part of today's discussion. We will jump right into the content for today because as everybody knows with a good Monigle presentation, we've only got about 250 slides to get through in the next 45 minutes. As Daniel had teed up just in terms of the broader transformation that we've all been dealing with, facing and being challenged to address, we had the opportunity in the midst of the pandemic to conduct interviews with a diversity of individuals across healthcare, different disciplines, different perspective, different points of view. There were 4 key areas that we learned and wanted to share with you all today. And as best we can, take what we heard and translate those into the specific activities taking place within those organizations, but also within the organizations represented by Jim, by Cindy, and by Chris. So as much as possible, as we're thinking about these bigger picture shifts, as we consider the imperatives for how we each become more consumer-centric in our individual mindset, as well as our collective organizational one, as we define strategies to be more innovative and to think differently about where we're operating, and then ultimately, how are we shifting that organizational momentum, continuing to push our enterprises forward. Those are our objectives for today. And as always, we're going to do our best to make it as actionable and as immediately implementable as possible through the examples and discussions. As we mentioned, myself, Chris, and Cindy took some time during the pandemic to reach out and to connect with folks with a structured interview guide across a diversity of healthcare institutions, big and small, academic and not, specialized and a bit more broadly focused. So we want to use today's discussion to bring to life some of the things that we heard from leaders across this diversity of enterprises. But we also want to make sure that we're thinking about it through the lens of our consumer as well. So as many of you may know, we do a report from Monigle each year called Humanizing Brand Experience. This particular year, we talked to more than 30,000 healthcare consumers, rated 202 healthcare brand experiences. And what we're going to use that insight for today is look at this balance, this, in some cases, tension, in some cases, opportunity for pivoting through the lens of both the stakeholders that we had a chance to speak with, to talk to, but also based on what consumer needs. So let's always be keeping that inside out and that outside in mindset for each of us as we dig in today. There are 4 key areas that we will spend some time on. We'll talk about those bigger shifts that we heard from leaders across the industry. We'll talk about 4 key areas, whether it's about being there for our consumer audiences, the role of purpose in unlocking collaboration, culture and its contribution and guidance for how we move forward, and then thinking about our model for the future. We've got 4 specific elements of an action plan, and then our goal will be to leave some time at the end for questions. As Daniel teed up, if you have any questions, please feel free to drop them into the Q&A panel We'll keep an eye on them throughout the course of our discussion today, and we'll do our best to answer both in line as well as at the end. With that, let's jump into it. We'll start with these bigger shifts. What did we hear from those stakeholders across healthcare when we were exploring their individual leadership mindsets in the midst of the pandemic? 75% of the respondents that we spoke with talked about this positive impact of COVID through the lens of communication, deepening and broadening the empathy of their organization and their leadership cultures, and then also the personalization that was taking place or taking root within their organizations. So let's start and immediately open it up to the group here. Do you agree? Do you disagree? And how did it come to life within your organization? Chris, why don't we start with you?
Thanks, Justin. I'd say for us, the communication, empathy, and personalization were always a part of the experience we wanted to deliver. I think the pandemic changed things a bit in that it was suddenly more desired and expected, both by our employee groups, our physicians and practitioners, and the people we serve. And so I think that shift really helped us crystallize the importance of that. People were suddenly focused on the process. I mean, we looked at things like, should people come in? Where should they come in? What is the process that they should go through? I mean, we were looking at minute pieces of the customer journey that we hadn't really looked at before, how to communicate around them, how to demonstrate empathy with barriers in the way. And I also think the community reached out to us, so the flow was back and forth. And one prime example of that is that we had our board, our sponsors, our community members, first responders came to our organization to express their support and acknowledge the importance that our team provided to the community during the time. So I think that was a good example of how, how much this changed during this time.
And Jim, from your perspective, talk to us a little bit about your alignment there within your organization, how COVID might have impacted communication, empathy, personalization within your leadership culture.
Yeah, I definitely agree, and I agree with what Chris said. Some of these things are part of our organization already. The challenge was we had half of our workforce working from home, and the other half that were still working on the front line. So finding way to have meaningful communication with the team and still continue to develop those meaningful relationships with folks. So we really did three things. First, early on, we really leveraged technology and we implemented these virtual town halls where we could communicate on an ongoing cadence with all of the team members across the division and make sure they got the information they needed. The kind of second thing we did was implement tiered huddles across the organization at 5 different levels so that team members from the very front lines could cascade information, issues, barriers, things like that up through the organization and cascade down. And that helped us with faster issue resolution, being able to answer questions and really hear the voice of the team member and being able to respond. And I think later on in the pandemic, as things went on longer than we had anticipated, we also implemented these small sort of sessions with 3 or 4 people. I called them my coffee sessions with my leaders. They had no formal business agenda at all. And the main goal was really just to check in with folks and see how they were doing. And I have to say, I learned something from each of these things, but that one probably had the most meaningful impact, getting at what the leaders were experiencing and being able to just listen and hear them.
Very helpful, Jim. Thank you. Cindy, you have a unique perspective here because as part of this process, you interviewed a number of the individuals at the organizations that we shared with the audience up front, but then have recently joined Redeemer Health. Talk to us a little bit about your agreement, we assume, on this particular topic and some of the ways you observed it coming to life.
So thanks, Justin. Yes, I do have a unique perspective. And as I listened to many of those that we interviewed, what Chris has said and what Jim has said has resonated true. And it really is what was really important was having the employees that frontline staff as well as everyone else get together and looking at things from a governance council standpoint as well. So being able to talk about processes and how that might impact the patients, and then also making sure that they were okay with everything that they were doing. And I know at Redeemer Health, there's been a great deal of emphasis put on that empathy and that personalization point on what can we do to make sure that we are paying attention to every aspect from that consumer standpoint. And again, thanking employees regularly. And that has become as important as we go through this process, and as the pandemic is waning, we need to continue that with employees. I think that becomes even more important now. So yes, I completely agree.
Great, thank you, Cindy.
Thank
I
you.
think one of the things that was especially interesting as we analyzed what we had heard from those leaders that we engaged in these interviews was this notion of shifts that were taking place within our industry, some of which we were driving very purposefully, some of which were happening maybe in spite of some of the challenges that we were facing. So for each of these three shifts, we'd love to hear a perspective from each of you in terms of what you experienced within your organization. This first shift that we observed and heard from people was around a repacing of how we make decisions, from slow and often siloed to much more rapidly responsive, maybe not as fast as the turbocharged roller coaster to the right, but much faster than we historically have. Love for each of these, maybe you take a minute and a half or so and talk a little bit about how this came to life for you and how you're sustaining it. I think, Jim, let's start with you. How did this particular notion of pace impact you and BayCare?
I think the example I'll share was very early on in March of 2020, and I got a call from our chief medical officer on a Friday afternoon at 5 o'clock. And it was just as testing was beginning to ramp up and nothing was happening in Tampa Bay. And he said, Jim, I'd really like you to get drive-through COVID-19 testing up and running. Oh, and by Wednesday of next week. And, I think we had to very rapidly pull a number of areas in the organization together that probably historically had not worked this fast and this quickly together to get to a resolution and to get something up and running. And the different teams worked all weekend to get a process up and running. And the quote I always like to use is, we have a tendency to always want to get things perfect before we roll them out and implement them. And I think we very early on said our mantra is going to be, don't let perfect be the enemy of good. And so let's just get something up and running. And then in the spirit of process improvement, we met every day and tweaked the process over time. But that Wednesday, we had 7 drive-through testing sites up and running. We had marketing involved and communication because they were doing the signage and all of the media relations for that. We had all of our facilities colleagues getting leases for the sites that we did. And so it really involved a group of individuals that had to move relatively much faster than we had in the past.
Jim, that's a great example and a mantra that I think the industry could benefit from pretty significantly, and one that's much more common in other industries, but a little bit less so in healthcare. Let's talk about the second shift that we observed when speaking to healthcare leaders, this notion of redoubling down on culture and revolutionizing the way that we think about, prioritize, invest in, and think about culture. Cindy alluded to this a bit earlier, the importance of thanking as a component of culture, but Chris, would love for you to talk a little bit about how did this impact experience at Redeemer Health, and how will you sustain it going forward?
I think the biggest factor that we saw both at Redeemer Health and in the interviews that we conducted was this sort of convergence of work and home. And, the confluence of those two things really changed culture. For instance, at Redeemer Health, we had to grapple with the work from home issues. We're a conservative organization generally, and so there was a reticence to allow work from home in the past. And faced with the challenges that we had to let go of a lot of that concern and just kind of leap in and trust people. And I think the end result was that it forged a stronger relationship between the organization and the employees that were able to take advantage of that. We also had emotional support at a higher level than we ever had before. We turned some of our forward-facing resources that we had used for our community. We kept those in place, but then we brought those to bear for the employee population because the challenges they were facing at home were definitely an impediment to their presence at on the work site. So behavioral health, our chaplains, we have a program for financial support for employees that are facing challenges, and we increased both the loans and the grants that employees could apply for due to financial challenges they were having. I also heard in the interviews that I conducted that people were getting very creative. They were using care.com to help employees who had at-home care challenges for children or older adults in their home, so that they could come to work and help contribute with hours at work. And I think just enhancing the visibility of leadership seemed to be something that helped people sustain that work-life balance as much as possible. And I think these are all programs we should sustain moving forward. We shouldn't back away from them. We should keep them. They're important morale boosters.
And it's such a diversity of opportunities to potentially provide from a culture standpoint, especially as we face challenges in recruiting and retaining our staff, whether it's nurses or other areas of expertise across the organization. Let's move on to the third shift. The third element that we heard in the interviews that were conducted included this notion of redefining success through the lens of consumer centricity and putting consumers at the center. Again, thematically, very similar to what Jim was talking about earlier, in that the model is much more common in other industries. It's less so in healthcare. So Cindy, from your perspective, based on what you've heard and what you think about experiencing and guiding going forward, how did you address this consumer centricity element as you think about things you heard and then things going forward at Redeemer Health?
Yes, thank you. Well, in healthcare, we've talked a long time about the consumer-centric model, and we've done an okay job. We talk about the patient journey. How are we following them, making sure that it is easy? So I would say the shifts that I heard, and they're obvious, they're from that digital standpoint first. So people went from having telemedicine available and all of a sudden being able to actually utilize all those barriers in order to do telemedicine were removed. So people moved forward with virtual visits. They were able to implement that. And again, really a wonderful shift, particularly for some of the specialty care organizations, because many of those families and patients are traveling long distances. So that was very, very helpful and very good to go ahead and implement that. In addition to that, listening to making the patients feel safe in the space that they are in, and making sure that they were comfortable in coming to the facility, because there was lots of residents to really not reticence to say, no, I'm not comfortable going. So making sure that people understood in that emergency situation, what do you need to do when you need to come to the hospital, or can you do something from that lesser level of care? Making sure that it was easy for patients to get online, and having a variety of ways to do that, depending on the age group and that type of thing. Looking at the critical services, again, I think was a very important piece. And then one of the things that I think was really important here at Redeemer Health, and they're continuing that, is that they have a companion waiting area. And I think that really has made a difference. So when your loved one goes in for a service, rather than waiting in your car, they actually provide space. We provide space where the patient's family member can sit in that comfort, get coffee, do whatever. So, and they are, the room is sanitized. Everything is put together with regard to COVID standards. So,
Great.
and I also feel like hopefully we can continue to move this forward.
Well, in the spirit of a slightly different moving forward, let's keep going from a content perspective. Want to make sure we can pick your brains about some of the other topics outlined here. In each of the next mini sections, we want to continue a flow here that includes basically 3 steps. We're going to share with you something that we heard from the folks with whom we interviewed. We're going to share a consumer perspective based on data that's been collected. And then we're going to look at it through the lens of a pivot point and open it up for the folks on this call to raise some of the experiences and best practices that they have seen brought to life. So in the spirit of this first one, this role of being there for those we serve, one of the things we heard very clearly from our healthcare leaders with whom we engage was this idea of COVID-19 really forcing us, maybe more so or more quickly than we had expected, to be able to convey very transparently, very authentically, that we have to be here for our individual patients, the consumers, and ultimately the communities that we serve. That was very clear from a healthcare leader perspective. Now, what's interesting is that's also of critical importance from a consumer point of view as well. When you look at the most important emotional attributes, which is one of the 4 main areas of focus in our humanizing brand experience study, the idea of security, which we define as giving people reassurance that they, healthcare organizations, healthcare brands, will be there for me when I need them. That is the singular most important emotional attribute for people. So if you think about this, what's created here, there is this opportunity to build reassurance, to build that connection. And it has to do with how we actively reach out to people, how we continue to invest in and improve what we deliver from a person-to-person relationship or service delivery perspective via bedside manner, or more and more a virtual bedside manner, and how we get questions answered from individuals. That also helps to creating that sense of security. But if you think about the convergence here, let's talk a little bit about this pivot point. The ability for a healthcare organization to be there for people in the way that COVID-19 has magnified its importance is really based on our capacity to find issues, create solutions in real time. In real time is not necessarily our specialty, as was evidenced by Jim's mantra for the setting up of testing. You have to leap over these hesitancies that have always slowed us down. So a question for all of you, when you look forward, how do you plan to help your organization identify and act with greater speed and greater decisiveness? Chris, would love to start with you on this particular one. What immediately comes to mind?
I think the most important thing is to keep the sense of urgency. And balance that with a sense of pace, if that makes sense. Because I think what we saw over the past 18 months or so is this frenetic pace, right? That came out of necessity. So how do we balance keeping a pace that's reasonable, but not back to where it was? And I think that's really just this keeping this sense of urgency. And so, I've been talking a lot with my team about keeping pace without burning people out. And that's a delicate balance. The other thing I would say is to keep focusing on tech, because tech enables us to move things forward. We're not always able to implement tech quickly in healthcare. And so I think utilizing other people's experiences with tech and learning from them and sharing those experiences more broadly will help people advance that cause and build on what you already have and expand it to services more quickly. So building on what you have, not sort of resting on your laurels.
Jim or Cindy, anything else that either of you would add?
Well, I definitely agree with what Chris said about the sense of urgency and the pace, keeping that going, and how we're trying to do that is, I think no one knows those frontline consumers like the frontline team members do. And so, they can act quickly, and our tiered huddles have really helped bring to light issues that they struggle with on a daily basis and remove barriers quickly. And the other two things I'd say that really support that is visibility of the leaders. Cindy referred to this earlier. We were visible before the pandemic, but it's really an expectation now that we're all out where the work happens. I mean, it started in the drive-through. We all were assigned a drive-through. We were there every day with the team. So the team wasn't out there on their own. We were there to help, support, do whatever they needed. And the last thing I think, which my leadership team has really started to focus on, is give all of our leaders more autonomy to act on things more quickly and allow them to make mistakes and move forward, because we can address things much faster that way, as opposed to bringing decisions all the way up through and taking time to do that. Just get out of their way and let them do what they need to do.
I would agree, and I agree with what both Chris and with what Jim said. I would also like to bring the point up that I think is really important, and I don't want us to go backwards on this, is that breaking down of those silos, those relationships between operations, experience, marketing. Let's go ahead and keep moving that forward, because that is what is going to make the difference in patient experience.
Great points and lessons for the group listening in here. Jim, you're really taking that idea of going to where the work is to heart. It looks like you're in an exam room there. So you're taking that very seriously. All right, let's keep going. The role of purpose and collaboration. And when we hit the question, Cindy, I'm going to pass it over to you. What we heard from our healthcare leaders when we were discussing this role of collaboration and this kind of unheard of collaboration is that it's enabled or it's enlivened by everybody being able to rally around a singular idea, everybody having a shared starting point. And when you think about that idea in the context of how we move forward, it's about having a clear and powerful purpose. Call it a brand, call it a purpose, call it a mission, vision, values, whatever you name it is not what matters. It's really about having that clear idea around which everyone can rally. It has to be something that connects and meets a very fundamental human need. It has to inspire not just your people, but then the ecosystem of opportunities and experiences that are being created. It has to empower people to take action, which I think was embedded in what Chris and Jim and Cindy were describing. We have to enable people to take that level of action out in the work that they're doing every day. And then it has to play a role from a societal context standpoint. We do play a critical role in the sociocultural fabric of our communities, whether we're a big sprawling organization or a smaller one. We do play that role. And that idea on which we all focus, the starting point from a brand perspective, from an experience perspective, has to provide that level of context and reach. One of the action items that we often task people with when digging into an understanding of their brand or their experience is this question of, if we asked 100 people within your organization, what is that shared starting point, that grand unifier? And if you're getting 100 different responses, it's more challenging to collaborate because we're not on the same page. And one of the interesting observations from a consumer data perspective, and again, this is coming out of our humanizing brand experience research, there's a hesitancy for healthcare organizations right now to talk about anything that's not COVID specific. But we saw nearly 60% of consumer respondents asking that they're equally interested in knowing about COVID-19 and knowing about everything else that you do. So hopefully one takeaway as you think about this particular data point is the almost freeing from the expectation of only talking about this one topic and getting out there and communicating, whether it's via marketing, whether it's via our staff from a person-to-person delivery perspective, but it ultimately has to anchor back to that singular idea. So the pivot point emerges again pretty clearly here. If we're going to maintain that high level of communication, collaboration, we have to have some shared goal. We have to have that clarity and that singular point from which we all start. We have to be able to rally around it and convey it out to the world. The permission is there. So with that in mind, for each of you, how do you envision defining and aligning your organization around that goal so that you can either further propel or even kind of reinitiate some of the collaboration that has taken form or taken shape throughout this COVID-19 pandemic. Cindy, let's start with you on this particular topic.
Yes, thanks. As I think about this, it all goes back to your brand promise and you take your mission, your vision, your values, and you really take your values, and those are putting things into action, and make sure that you are living by that, you are communicating that on a regular basis, and you have regular activities where you are engaging the employees so that patient experience comes first. Looking at if it's a process, how does the experience impact the process overall? Looking at Redeemer Health, there's something that we use that really embeds things in, and it's called the transformation wheel. And really what that does is it takes the essence of the brand, it takes that ethos, it takes the values, it takes the mission, and it moves it forward into action. And everybody starts from that same place and that same purpose. So it might look very different depending on what the process is, but using that consistently is extremely important. When people are recruited, when people are onboarded, all of that must be immersed within the brand and moving things forward.
Chris or Jim, anything that you would want to add on this particular question?
I'll just add, I think I've made a jump into the operational side since COVID. And one of the things I think really moves us forward is, as a leader, doing rounds, being around people, being present, but asking very specific questions about how are you helping our values come to life inside your interactions with the people that you're serving. So asking some very specific questions around that and expecting that is the key to aligning people around a common vision.
That's great. Jim, I'm going to come to you first on the next section, but let's keep going for the sake of time. This idea here, we always hear the phrase, which I always screw up when I try to play it back, culture eating strategy for breakfast. But I think if there was something we heard pretty consistently from our healthcare leaders, it was this notion of people eat both culture and strategy for breakfast. And what does that mean? Well, the rigid management processes, some of the protocols that have always guided us were in many ways discarded so that we could be more flexible, so that we can reinvest and double down on the role of employees and culture. Each of our panelists have talked about that today. And that's supported from a consumer data perspective. Our humanizing brand experience framework has 4 areas of focus. We talked a little bit about the emotional earlier. It's also guided by intellectual attributes, sensorial features, and the behavioral traits. Now, more important than the buckets overall, one of the analyses that we did recently included the exploring the quantitative relationship between each of those attributes in the study and HCAHPS scores, knowing that that's such a critical to success metric on the minds of many healthcare leaders. And the punchline of this story emerges very clearly at the top of this list, and that's that having the best people is the singular most important and most strongly correlated attribute in driving HCAHPS performance. So just as healthcare leaders are working to abandon some of the rigid processes that have gotten in the way of being more people-centered and celebrating, elaborating, building on their cultures, it's also what's expected from a consumer standpoint if we're going to move the needle on HCAHPS. So it sets up another pivot point for discussion. The group has talked about workplace flexibility. We talked about changing expectations. There was a point of view that our respondents thought we would get even more oriented to an empathy-based culture within our healthcare systems, which many of you listening today might think, well, wait a minute, aren't we already rich with empathy? We're in healthcare. But unfortunately, that's not necessarily where we've anchored ourselves. So Jim, would love to start with this question for you. How have you shifted employee culture toward empathy, and how do you envision sustaining it going forward?
So I'm so glad you came to me for this question, because this is something I'm extremely passionate about, was passionate about before, but I think one thing we can all agree as leaders, I think now it's more important than ever, especially as we see where we are with recruitment and struggling to get positions filled in the organization. So I think it's a two-pronged approach. There's that recruitment of all of our open positions, but retention is as important, and it ties back to this significantly. So we do something with the leaders. So I think it ties to a lot of what we've all said, that being visible, being available to the team. But what we've all tried to do as leaders is really trying to find on the retention front, what are those rocks in our team shoes, right? And removing those rocks in the shoes. So what are those things that make somebody get to the point where they want to leave the organization? Removing those. And so you have to really be present. You have to be talking to the staff. You've really got to be listening. It gets to my point about getting out into the organization. And we've learned a tremendous amount of what folks need. So I'll use my home care team as an example. They've completely, as a result of talking to team members, redesigned the onboarding and orientation and precepting in the division, because they heard from the nurses they felt kind of dropped into the field. Getting them the tools they need. They were writing med lists in the field. So we bought mobile printers for everybody and are implementing those as we speak. Small enhancements to our EMR that make the flow much more efficient for those nurses. And then we kind of close the loop with my message monthly, which is, you asked, we listened. And we demonstrate to the team that we're listening to all those things and communicating back. And we do that across all the areas of the division. And you'd be surprised about what an impact that has on the frontline team member.
A great example, Jim, and that notion of taking the rocks out of shoes is another mantra that we can be thinking about, because it's often the little things, those perpetually annoying things that pile up. Chris or Cindy, do either of you want to weigh in on this particular question? All right, for the sake of time, I'm going to take the last, you weren't quick enough on the mute button, so we're going to keep going. All right, a different model for the future. And this is the fourth of our areas of pivot point discussions, and then we'll move into some of the broader takeaways before we open it up for Q&A. Most of our IDI respondents, the folks with whom we spoke, nearly 90%, are starting to rethink what success looks like and the role of adaptability, flexibility, consumer-driven innovation, and the idea that healthcare success, as we think about the future, is going to be less on pure profitability and competition or share stealing from others, and more on how we build that people centricity and cooperate. So with this mindset in place from a healthcare leader perspective, we see from a consumer point of view that this is absolutely the case as well, that consumers have an expectation that we are delivering something that's more oriented to them. The attributes from a behavioral perspective within humanizing brand experience that have become increasingly important. In fact, the only ones that have changed meaningfully year over year is about easiness of contacting, availability and getting appointments, digital tools, and web experiences. These elements that people have expected and how other industries have retrained consumers to desire it from us create a model that we have to aspire to, focused on consumer centricity. And if you look at what we describe as the disruptor brands in the healthcare category, the brands that are nibbling now but have the potential to eat our lunch in the future, of these top 7 disruptor brands, which we evaluated in the same way we evaluate every legacy healthcare brand, 6 of these 7 would beat Johns Hopkins Medicine, which is the top overall brand in our brand experience ranking. One of the characteristics that's consistent here is that they're consumer-centered. They are driven not by the legacies of how their enterprises have come together, but they've started with the consumer in the middle. And that sets up the role then of how we think about consumer centricity and how we think about change with these individuals in mind. We have to work to continue to be more innovative, responsible, and consumer centric. And we've also shown that we can move much faster than we historically have. I think you've heard examples of that from each of the panelists today. The benefits could undoubtedly be significant if applied then to other areas. So we'd love to focus then on this question. How have you helped your organizations to become more consumer-centered, to move toward this idea and this model going forward? Chris, your preemptive unmuting, I'm passing it over to you.
Okay. I feel passionate about this, so I unmuted. At Redeemer Health, what we've tried to do is elevate the soft skills to be equally as important as technical skills. And as we move forward in the age that we're in, and a lot of what the data you just shared, Justin, I think speaks to this, is people's ability to engage with people and make an emotional connection with them inside the healthcare experience is really very important to the future. It's important now, it's important in the future. And so some of the things that we've done is we've added an audition to the selection process for new talent. It's in addition to a traditional interview. It asks people to speak about their time, their talent, and their passion. And the manager participates at the same level with the employee, so they make an emotional connection with one another, makes more comfort when the employee arrives for their job. And it also gives us the opportunity to hire for fit, because we assess those sessions based on how does this align with our values. We want people who can deliver emotionally and make emotional connections based on our values, express those values inside their interactions. We've also redesigned onboarding, as Jim alluded to, not to just be the 2-day experience when you come on board, but a 365-day introduction to the organization. It includes a journal and activities with your manager, and helps you get to know the organization on a lot of levels, and provides opportunity for engagement. So we feel those soft skills are equally as important as technical skills.
And Cindy, anything else that you would add?
Just to add, in just having gone through the onboarding process here at Redeemer Health, it really does make a huge difference in getting to know people, and having that audition process is different than what I've experienced in the past. And it really was unique, and I really believe does make the difference. So that was something. The other thing that I would say, as I think about that consumer-centric care and consumers, is that I think we need, and we've talked about this already, it is empowering those employees to do the right thing. So making sure once they get into that position, let's go ahead and make sure that they do have the answers, and they're not scripted, and they know that they can make that difference. And we've all talked about that. And then the other thing I would say is looking at mapping that consumer journey, if you will, and looking at each of those points of interaction, so that we can make a difference, and where are places that we can easily pivot so that we are covering that. So,
Jim, anything else you'd like to add here?
No, I think they both have covered it. I'll just add one thing. I think our employees, to Cindy's point about empowering employees, I think coming out of this past year, they're going to feel empowered, because they've had to handle some of the most difficult situations that they have in their career. So we've put a lot in these folks' hands. So I love the concept of the audition and getting the right people in place, because the people that have experienced this over the past year are coming out completely different than they were before.
Absolutely. And then we have to have the processes, the systems, and the tools to be able to accommodate that difference. I think great lessons based on some of the pivot points here. Let's shift into our last section before we open it up for Q&A. And again, if you have any questions that you'd like to pose to the folks on the webinar here, please feel free to drop them into the Q&A tab. There were 4 key takeaways, key themes that we identified as part of this work, talking to those healthcare leaders, those broader things that we could implement in order to perpetuate our go forward, more consumer-oriented, experience-rich model. So let's tee up each of these. And I would love for each of you to tell a story most appropriate to your organization and how you envision taking each of these forward. We'll start here, Chris, with you. You started to talk a little bit about this, but the role of soft skills in addition to clinical and technical. Now, let me play skeptical physician for a moment as you consider the story here, where you're going to tell me that clinical and technical doesn't matter anymore, but it's not that at all. It's about having to, or the opportunity to take a broader view, right?
Yes, it is. It's really about holistic care when you think about it. And I think the way that we're training practitioners has probably evolved over time. And I think we're finding less and less practitioners think about it just being about the clinical or the technical skill. It really is about, we're in the people business, right? We take care of people at some of the best times in their lives and some of the worst times in their lives. We don't just treat patients, in my case, residents and clients. We also take care of their families at the same time. And we're in a human business. So humanizing this requires people that are relationship builders. And so I think elevating, it's not about a choice between clinical, technical, or soft. It's about elevating all of those skills to have a well-rounded employee who can deliver based on your values and meet the expectations and exceed the expectations of the people that are in front of them.
I think the key takeaway, if you think about the action coming out of this, then immediately for the folks listening today, how do we introduce this notion or expand the notion of soft skills in addition to the clinical and the technical? And it's often a collaboration with our HR colleagues, and then thinking about it through the broader hiring manager point of view that we have to be thinking about.
And one more thing, Justin, is I would say your experienced design professionals, having come out of that most recently, really can be a help to your teams on how to design that into your experiences. Some people come to those skills easily. Some people need a little bit of practice. So allowing people a safe space to practice those skills and learn how to develop them as they have had the opportunity to do their technical and their clinical skills, and treating them the same as something that they can learn to stand and deliver.
A great point. Let's look at our second key takeaway. It was the notion of expanding our legacy areas of focus within our key departments and starting to build a more holistic, a more cross-functionally oriented. We framed it as brand experience coalition, Chris, Cindy, as we were pulling out this insight. But Jim, let's put this one to you. From your perspective, how are you building this more holistic and cross-functional group when you think about BayCare and the future of what you all are prioritizing?
So I'll start by saying I wish I had that statistic that you shared in the last section, that 57% of people wanted information when they were coming in for COVID about other additional services, because one of the things we learned in our drive-throughs in the first 6 months, 50% of the people coming through had never experienced the BayCare brand before coming through there. And we delivered a great experience on that drive-through. So our marketing and communications folks started saying, why don't we come up with a campaign, Get Care Now, that we send out to people, because they all signed up to get their results for COVID via text message, and we could then communicate with them ongoing. And so we found that by proactively doing that, we connected 38% of those people to other BayCare services. And now our goal is to make them sticky to our brand, right? So, and then moving forward, we've created a whole group called our Care Navigation Group, which will do that across all of our service lines and say, if you're utilizing one aspect of our organization, we should be connecting you to the next level that you need, or something else organizationally. So again, it breaks down silos, it gets people working together, and it helps the consumer navigate and gets them what they need, removing, I like to say in a frictionless manner, but getting rid of all those roadblocks that they would traditionally have getting access to care.
You bring up one of the most common discussions we've been having with clients and folks in healthcare across the country. It's these under-leveraged touch points. You were talking about the drive-through. Think about your virtual care waiting room. We've put so much time and energy into what we communicate in our waiting rooms, yet for at least the majority still in our experience of virtual waiting rooms, say your provider will be right with you. Nothing about us, nothing about the brand, nothing reassuring, nothing that helps people to understand a bit more the mindset and the consumer orientation. So huge opportunity there, and a great way to think about this from a cross-functional perspective. Let's move on to the third takeaway, focusing leadership on experience. I think what we heard pretty clearly from stakeholders across the healthcare group with whom we spoke is this opportunity to make experience front and center through a whole variety of facets. So Cindy, would love your perspective on how you would envision collectively focusing leadership on experience. How do you get there?
I believe that this is just such an important point as we move forward, is to make sure that leadership understands and embraces this and they have. So in moving forward, we need to make sure that we are giving people those skills from that experience standpoint. Going out into the field, looking and seeing what's happening from a patient care standpoint, looking at each of those points of interaction and where can we make that difference, having those key quick pivot points. Here at Redeemer Health, there is a program called Experience You, and Experience You is really to help lift those managers as well as staff, provide good experience to patients, giving them ideas, helping them really put the values into action. And one of the things that has happened here is that it was previously an in-person class, and it was wonderful. It took a couple of days. You had people go away and come back. And now what we've done is it's since become a Zoom class. It's been abbreviated, and it's really trying to focus on those small pivotal points where you can just make those impacts quickly. And really, I think leveraging that, I see that eventually going to sort of a hybrid model, so that there will be some in person and there will be some Zoom as we move forward. Leadership embracing that, making sure that they are approving, making sure that the frontline staff have time to do this, and looking at all of those different organization-wide programs. I attended my first leadership update meeting this morning, and one of the things that I really enjoyed was that there were mission moments. So leadership talked about different aspects of making that difference with really living the mission at Redeemer Health. And it was very it made me feel really good. It made me feel really good to be part of this organization. So that's just one, top of mind example now. So.
Thanks, Cindy. If we look at the fourth element, as opposed to our planned discussion around it, I do want to make sure we hit at least open the floor for some questions. So just going to tee this up, the role of incentives in driving behavioral change. We all know that behavior follows incentive. And so when you think about the opportunities here, healthcare leaders were pretty consistent in saying that we have to make sure that our go forward incentives are driving the right kind of behavior and/or behavior change. We'd love to open it up for each of you to talk about this. I'm going to hold that for just a minute and move to the last page just to convey to the audience, if there are specific questions that you have, feel free again to drop them into the Q&A. While we potentially have some of those pop up, I will jump back one step and open this up for discussion. When you think about incentive alignment, Jim, maybe we start with you on this topic. How do you envision shifting incentives to drive that kind of behavior change?
Well, we use this as an opportunity this year when we were setting the goal that every single person in the organization is aligned around our online reputation management and star rating. So, 25% of our team award goal and 25% of our leadership award goals, but every person in the organization is really incented on creating that customer experience. And so they all feel connected to it.
Very helpful. Let me pose a question from the audience. Can you share any examples of how experience or messaging is being personalized? How are you bringing that sense of personalization into what you're delivering to patients, consumers, communities, et cetera?
One of the things that our experience design process does is asks questions about how you want the person you're serving to feel. And so by helping staff either ask that, we have ways to help them broach those topics, but also assuming how would I want to feel if I was receiving this service or at this point in the care process. It helps to personalize the experience because it helps your staff get in the shoes of the person on the other end. And then once you understand how you want that person to feel, then the next question is to say, well, how could you express that? How could you help that person to feel that way? And it helps really personalize the care down to the level of that individual that's in front of you being the most important thing to do that day. I'm not sure if that answered the question, but that's one of the ways that we try to personalize the experience.
We've heard a lot of discussion as well around the role of technology in amplifying the personalization of messaging via technology. So further segmentation of our audiences, thinking about messaging alignment to their attitudinal or behavioral profile, being able to target very specifically to those individuals with messaging, leveraging some of their electronic health record capability in order to do so. So those are some of the other things that we have heard from clients. Cindy, I'd love to pose another question from the audience to you if we could in our last few minutes here. So we'll have to keep your answer brief. But when will healthcare systems provide customer experiences on par with companies like Disney or Apple? Well, this is a beefy one. Oof. Or do you believe there are health systems doing this today? And if so, who are they? Who is leading the way? We'll do a quick one and then see if Jim or Chris have anything to add.
I would say that there are some good examples out there. And one of the places I would rely is I would look at some, and in listening to this, the specialty care hospitals really do look at that from that experiential standpoint. If you think about it from a children's hospital standpoint, certainly children's hospitals have always considered the entire family and looked at that journey. So I think that looking to some of the key children's hospitals really do make a difference. In addition to that, I would also, I'll point out, I spoke with Moffitt Cancer Center, and Moffitt has a wonderful patient navigation program. And so they are looking at that, at the patient experience and that patient journey throughout. So I think the specialty care hospitals can do it really well, and there's something that everyone can learn from that.
And Justin I'm sorry, I was just going to say, Justin, you may not say this, but I think your Monigle survey actually takes a look at leaders in, humanizing the experience in healthcare. And so that list may provide insight into who's leading the way.
Absolutely. We appreciate the not so shameless plug. Thank you, Chris.
Yeah.
That's a really interesting question and one worthy of some further debate. We could probably have a whole webinar just on that topic, but want to be respectful of time today. There are a couple other questions we'll revisit and get those answered from the perspective of the individuals that are here. But I just wanted to take an opportunity to say thank you to each of you, Chris, to Jim, to Cindy, for spending the time with the group today. Chris and Cindy, a special thanks to you. I really appreciated the collaboration, getting out and talking to all of these healthcare leaders, working through some of the insights and then being able to share them. Thank you to the audience for each of you spending a bit of your time with us. We appreciate the dialogue. It's always challenging without the ability to kind of debate, and I think we'll be back to that at some point. We appreciate the Forum for Healthcare Strategy for allowing us to set this up and have the discussion. Please, if you have a moment, fill out the assessment of today's content so that we can always continue to refine. And lastly, we hope to see you in September at the summit, bringing together experts from the field as led by the Forum for Healthcare Strategy to rethink and continue to push everybody's approach to managing healthcare organizations, teams in this especially challenging time. With that, that'll end our programming for today. Thank you so much again for the time and the opportunity, and we'll see you very soon.
Thank you.
Thank you.
Thank you.